the harmful health effects of inhaling tobacco are well established. Even with the use of pharmacologic or behavioral therapy, over 2/3 of smokers return to smoking within 1 year. Many smokers have adopted the use of e-cigarettes in an attempt to quit smoking. An e-cigarette is a device that may look like a cigarette, a pen, or a USB drive. Most e-cigarettes are made up of the following parts. The mouthpiece has a cartridge fixed to the end of a tube with a small plastic cup containing material soaked in a liquid solution. The atomizer heats the liquid, causing it to vaporize so that the person can inhale it. The battery powers a heating element. The solution, called e-liquid or e-juice, usually contains propylene glycol and flavoring. When the user sucks on the mouthpiece, the heating element vaporizes the solution, which the person then vapes or inhales. The nicotine content of the liquid can vary and is mostly unregulated. Some scientists suggest that e-cigarettes may be just as harmful as traditional cigarettes. Reports of lung-related e-cigarette injuries are increasing. Others claim that e-cigarettes are safe and can help smokers quit. The objectives of this study was to examine the efficacy and safety of nicotine and non-nicotine e-cigarettes with individual counseling compared to counseling alone. 376 participants who smoked greater than 10 cigarettes a day for the previous year and were motivated to quit were randomized to 3 different arms: nicotine-containing e-cigarettes with counseling, non-nicotine e-cigarettes with counseling, and counseling alone. The mean age of the participants was 52, 53% were male, and on average they had a 35-year smoking history. 90% of patients had previously tried to quit, 18% had a history of heart disease, and 28% had a history of respiratory disease. The primary endpoint was point prevalence abstinence at 12 weeks, based on self-reporting and confirmation with carbon monoxide monitoring. The 12-week smoking abstinence rate was 22% amongst those who received nicotine e-cigarettes, 17% amongst those who received non-nicotine containing e-cigarettes, and 9% who received counseling alone. The risk difference for nicotine e-cigarettes versus counseling alone was 12.8%, and a relative risk reduction of 2.4, both statistically significant. There was one incidence of COPD exacerbation which occurred 12 days after starting a nicotine e-cigarette in a patient with a history of COPD. There were several adverse events in the non-nicotine containing e-cigarette group. They were all adjudicated and felt not to be related to the treatment they received. In conclusion, nicotine-containing e-cigarettes and counseling for 12 weeks is efficacious for smoking cessation compared to counseling alone. Non-nicotine-containing e-cigarettes appear to have benefits which are intermediate between nicotine daily e-cigarettes and counseling alone. Very few serious adverse events occurred, however additional safety data is required.